I'm Farrar Duro, and you're listening to the PCOS Revolution podcast. Hello, ladies. Welcome back to part 3 of our special 3-part series dedicated to solving the mystery of repeated miscarriage and unexplained infertility. Now, if you missed our last 2 episodes, I encourage you to go back and listen to them to get an idea of how to start approaching unexplained infertility from a reproductive endocrinology and holistic perspective. Now, today we're going to dive into some questions we had following our webinar with Dr. Ellen Wood on specific topics that pertain to women with PCOS who are also struggling with trying to conceive. And I feel like many of you were in that unexplained category before finding out that you had PCOS. Or maybe you're listening to this podcast today and you're still not really sure if PCOS is affecting your fertility. To clarify, PCOS is a syndrome, which means it's a part of many different symptoms that could be different for everyone. This is part of the reason why PCOS is so hard to detect, and you might end up in the unexplained infertility category until you find someone who can detect it. This is usually a reproductive endocrinologist, but sometimes we've even seen patients who have been through infertility treatment and all who had no idea they had PCOS because their doctor never told them. Well, in order to have a diagnosis of PCOS, the following criteria need to be present. And this comes from the guidelines from the Endocrine Society recommending using the Rotterdam criteria for diagnosing PCOS. The Rotterdam criteria mandates the presence of at least 2 of the following 3 findings. Number 1, irregular cycles or lack of ovulation. Number 2, high androgen levels, either clinically by skin manifestations of androgen excess or high testosterone levels in blood. And number 3, ovarian cyst. And the cyst may be detected by ultrasound. So you'd need to have at least 2 out of 3 of those characteristics, along with exclusion of phenotypically similar androgen excess disorders such as congenital adrenal hyperplasia, androgen secreting tumors, Cushing's syndrome, thyroid dysfunction, and hyperprolactinemia. So if you have any of the following, then you would be excluded from a PCOS diagnosis. It's not PCOS, it's those, unless you have them coexisting, which typically you can see thyroid conditions a lot of times coexisting with PCOS as well. But if it's only thyroid, it's not PCOS. That's a little bit confusing. So to explain this criteria a little further, hyperandrogenism is diagnosed clinically by the presence of excessive acne, androgenic alopecia, or hair loss, balding, or hirsutism, terminal hair and a male pattern distribution, or chemically by high serum levels of total bioavailable or free testosterone, or DHEA. Now, the measurement of androgen levels is helpful in the rare occasion that an androgen secreting tumor is suspected. So a lot of times the testosterone is measured in blood work that when you see your OBGYN or you go for your annual, if you request that. And sometimes it's not. Sometimes you do have to ask for that. And next is ovulation dysfunction, aka oligo or anovulation, and it can mean the following. The definition of oligomenorrhea is cycles that are more than 35 days apart, but less than 6 months apart. And amenorrhea means the absence of menstruation for 6 to 12 months after a cyclic pattern has been established. And what about ultrasound? Well, a polycystic ovary is defined as an ovary containing 12 or more follicles or 25 or more follicles using a new ultrasound technology, which is way more sensitive, measuring 2 to 9 millimeters in diameter, or an ovary that has a volume greater than 10 milliliters on ultrasound. Now, a single ovary, meeting either or both of these definitions, is sufficient for the diagnosis of polycystic ovaries. So the next time you're at your gynecologist, you might want to ask if they're using a newer ultrasound machine and get your ultrasound report to check it against these numbers. However, ultrasonography of the ovaries is unnecessary unless imaging is needed to rule out a tumor or you've met only one of the other Rotterdam criteria for PCOS. Polycystic ovaries meeting the above parameters can be found in as many as 62% of patients with normal ovulation, with prevalence declining as women age. Because oligomenorrhea is common right after menarche, or when a girl hits puberty and starts her period, they found that it was reasonable to delay evaluation for PCOS in adolescent girls until 2 years after menarche. For this age group, they said, it's also recommended that all 3 Rotterdam criteria be met before the diagnosis is made. And so this is why it's so important to educate yourself on the symptoms of PCOS and get help right away. We see a huge difference when we have time to work with our patients for at least a few months prior to embarking on any medicated treatment for fertility. Even if you're not trying to conceive, you can definitely benefit from treating the underlying imbalances of PCOS, such as insulin resistance and metabolic syndrome, at any age. So in today's episode, we're going to discuss the top 6 PCOS supplements we use in our practice for women who are trying to conceive, and I'll also provide links to these in our show notes. Now, if you haven't had a chance to download the slides for this episode, along with the last 2 episodes, just go to www.freepcoscourse.com and sign up for our free 30-day PCOS Revolution Jumpstart, and you'll be good to go. Now, as I said in our past episodes, I'm so excited to start this free challenge with you and get to know all of you, and it kicks off January 5th, so I really encourage you to join our little Jumpstart group and receive all the bonus meal planning templates, menu plans, and exercise guidance specifically designed for women with PCOS to kickstart your weight loss and improve your energy in 2019. Okay, so I won't make you wait anymore. Let's get started. The first question we had after our presentation was related to how much vitamin D3 is recommended for women who are trying to conceive, along with women who have PCOS. Well, according to the Vitamin D Council, they promote taking a minimum of 5,000 IUs per day, and that will get most people to a blood level of at least 50 ng/ml. But you won't know if that's the case unless you test your levels, so it's very important to get your vitamin D levels checked. And the dosage will be definitely based on where your levels are. So just to maintain your levels, a minimum of 5,000 IUs a day would be helpful. And they did not think that 2,000 IUs is enough to sustain healthy levels. So vitamin D is a fat-soluble vitamin produced in our skin after being in the sun. And of course, the best source of vitamin D3 is the sun. If you have a chance to go outside every day and get a little bit of sun, maybe 10-15 minutes, that's perfect. But many of us don't have that luxury, or it's cold and rainy. And, one thing is to have that time to go ahead and do that every day. But if you don't, definitely a vitamin D supplement is very important. And the standard dose is 2,000 to 4,000 IUs a day, up to 5,000 to 6,000 in some cases. And vitamin D may improve total testosterone levels in women with PCOS. So it's very beneficial. Definitely ask your provider to check your D levels before you get started, just to see how much vitamin D you need. Some women we treat need much higher levels. Some are taking up to 10,000 IUs a day or 50,000 IUs in an injection form with their providers. So it really depends. But you do want to aim between 50 to 70 ng if you want to look at healthy reproductive levels in order to conceive, and also during pregnancy as well. The next supplement, number 2, would be one of my favorites. It's called Myo-inositol. And Myo-inositol is naturally found in fruits, beans, grains, and nuts, and is also made by the body. And we couple it with another inositol called D-chiroinositol, and it's actually been proven to help a whole lot with PCOS. And when you take 2 forms of it, so taking 2 forms of it's more helpful than taking either form alone. And the inositols have been shown to decrease insulin resistance, improve testosterone levels, support healthy blood lipids, regulate menstrual cycles, and promote ovulation. So there's so much to talk about with inositol. And the standard dose is 2,000 milligrams of Myo-inositol plus 50 milligrams of D-chiroinositol taken twice daily as a powder. So this is usually how we give our patients that. And the brand that we use is called Ovasitol. And some of you guys might already be taking that. And the most exciting research I've seen is actually that it can be coupled with an antioxidant as well to improve egg quality called coenzyme Q10. And that's how we actually use the 2 together. CoQ10 is a naturally occurring antioxidant produced in the body and found in virtually all cells, and it's essential for cellular energy production. So there are different types of CoQ10, and we use one that's highly bioavailable, so it's very concentrated. You don't have to take a million tablets every day or gel caps. So we use, I'll link to it in the show notes, the one we use, but we use 100 to 200 milligrams a day. And one of those capsules is actually equal to 750 milligrams. So it's pretty potent as far as absorbability and bioavailability. And what CoQ10 does is it increases ovulation and pregnancy rates in women with PCOS going through fertility treatment. Super helpful. And also, it's been found to improve blood sugar and insulin levels and total cholesterol and LDL. So it's definitely part of our regimen with our patients. Now, if you're talking about egg quality, another thing that's come out recently about melatonin, is another one we use, is melatonin is a hormone secreted by the pineal gland, which helps regulate sleep and also functions as an antioxidant in the body. And when combined with inositol, it actually helps improve egg quality in response to IVF. So our patients actually take a 3 milligram chewable tablet before bed. So the standard dose is 2 to 3 milligrams a day. And usually women with PCOS have low levels of melatonin in their follicular fluid, which may decrease fertility. So studies have shown that melatonin can reduce testosterone levels, increase follicle stimulating hormone or FSH, and improve menstrual regularity. Definitely that is a big bonus if you're trying to conceive on your own or if you're also preparing for a medicated cycle. So we also want to talk about vitamin B12, and we talked about this in past podcast episodes, but research has shown that long-term use of metformin can decrease vitamin B12 in the body. And that's not a good thing because a deficiency of B12 can cause permanent neurological and nerve damage, as well as mood changes and decreased energy. So if you're taking metformin, ask your healthcare provider to check your B12 levels to determine if taking B12 is right for you. We have checked this on many of our patients, and we find that most of our patients are deficient and end up needing a little extra help with B12. So that sums up the supplements that we'd like to talk about, with the exception of one of my favorites, omega-3s. Now, the omega-3s are very important. They're fatty acids found in fish such as salmon, herring, sardines, tuna, trout, and mackerel. And we use a form from greenlet mussels that are sustainably farmed. So definitely you want to look into omega-3s if you're not eating fatty fish at least twice a week. And that would be the wild type fish, because farm fish have very, very low levels of omega-3 in general. And omega-3 fish oil can reduce depression, improve testosterone levels, and regulate menstrual cycles in women with PCOS. So you really want to consider this. There's also a lot of research on improving egg quality as well. So the standard dosage is 2,000 to 3,000 milligrams per day, and we highly recommend this one for both men and women in general. Now, all these supplements are best taken with a highly methylated prenatal vitamin. So there you have it. Those are my 6 favorite supplements that can help PCOS and boost fertility. And now we'll address the final 2 questions, which had to do with what diet is the best diet for improving fertility, and also how much exercise should you be doing if you're trying to conceive. So these 2 questions are very important because on an earlier episode, I mentioned how patients who were on a vegan diet were not doing as well with regulation of their cycles and also are trying to conceive. And especially with PCOS, the most important thing is looking into the glycemic index. So what I meant by that was that if you're doing a vegan diet, it's very important to make sure that your glucose and insulin are responding well. And it's definitely possible to lose weight and feel wonderful and do a vegan diet correctly. And I really encourage women who want to do vegan or vegetarian diets to talk to a nutritionist and do it the right way. There's definitely great sources of protein out there that are soy-free and on the lower GI index and don't have a ton of carbs in them. And those are the ones that you'd be choosing. Now, given that it is harder to maintain a vegan or vegetarian diet long-term without help. So if you're doing it correctly and you're feeling great, that's really, really wonderful. It is shown to be great for your cardiovascular system. And that's one of the things that has been shown with PCOS to be a problem later on. So that being said, we're going to talk a little bit about the Mediterranean diet as well. In general, the Mediterranean diet has been researched to be one of the best diets for couples who are trying to conceive and undergoing IVF. And in fact, it showed a 30 to 40% increase in success rates for couples that were in their 30s. And when they surveyed them, this was actually done through an IVF center in Greece, they found that couples that were eating very, very closely to the Mediterranean diet actually had a higher pregnancy rate. And they also noticed that pregnancies in general were healthier for women who were eating Mediterranean. So if you're thinking of changing up your diet drastically, talk to your nutritionist and find out what's best for you. We will be providing recipes as well in our 30-day, and those recipes are vegan, vegetarian, Mediterranean, and whole food recipes that are all on the low GI index scale. There's even some really delicious desserts. Everything is dairy-free in the challenge, and I really want to encourage you to experiment with what is best for you and how you feel during this challenge. In my case, eating vegetarian diet for 10 years really threw off my blood sugar quite a bit. I was eating a lot of refined carbohydrate and a lot of foods were not healthy. I was in high school and college at the time, so of course I could have definitely used the help of a nutritionist in figuring out what was best for my body. So just remember to key into how you're feeling, how your glucose is, get your numbers checked on a regular basis. And we have an interview with Angela Grassi in an earlier podcast episode, which I think you'd find really helpful if you'd like to find out more information about how different types of diets work with PCOS. And honestly, the solution is never really a diet, but to eat healthy whole foods. And the last question was about exercise. And exercise is extremely important for women with PCOS. And if you're trying to conceive, you can definitely continue to exercise. If you're starting an IVF cycle, you want to check with your doctor because most of the time they're not going to encourage a lot of cardiovascular or heavy exercise during that time. For PCOS, HIIT has been shown to be extremely effective, high intensity interval training, and you want to start off slowly, walking or doing something you really enjoy. Perhaps dancing, and finding something you really, really like and that you want to stick with. That's the most important thing, is consistency. So it might be that you start off once or twice a week with walking around your block, and then you might want to increase that to 3 times a week, and you go a little bit further each time. Bring your favorite podcast or music, whatever you like to listen to, and take your dog with you if you'd like, and really just enjoy getting out for a little while and making that part of your routine. Now, I found that a lot of our patients, and I kind of went through this myself for many years, find that they just don't feel worthy enough to really get into a routine. They don't feel like their bodies really deserve that attention. And I find that we can really get hung up on this sometimes. We can create all kinds of excuses in our mind and we just don't follow through with it. So part of what we're doing with the 30-day challenge is actually providing exercise templates and really trying to put that in place as part of your routine so that you can kind of get into the habit of creating a nice, healthy exercise routine that's good for you. So we'll have our personal trainers on our Facebook Lives and just really giving a lot of good tips. And I promise just starting small is going to feel so much better than never starting at all. I should actually coin that term. So I didn't mean to rhyme and it rhymed. So I hope that you guys have enjoyed this episode. I really look forward to the upcoming weeks, and we'll be talking to some of our staff who actually have PCOS. I look forward to seeing you guys in the group. I hope that was helpful. And if there are any questions, please leave comments on our Facebook page or our website below this podcast episode. Thank you guys for listening and take care.
And that's the end of this episode of the PCOS Revolution podcast. If you've enjoyed the show and want to help me spread the word about how women with PCOS and hormonal imbalances can lead happier, more healthier lives, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to have a question answered on the show or would like to recommend a guest, please go to floridacompletewellness.com/podcast. If you're on social media, you can follow me at facebook.com/FloridaCompleteWellness and twitter.com/FloridaComplete. where I post a lot of interesting research, webinars, and articles on our blog about really getting to the root of hormonal imbalances like PCOS. So it's a great way to stay in touch with the latest developments. Thanks so much for listening, and see you soon.